From the moment we are born, stories play an integral role in connecting us to the community we're a part of. Today we're taking a look at the importance of storytelling and compassion in leading teams in today's healthcare environment. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, speaks with Dr. Beth Lown, Chief Medical Officer at Schwartz Center for Compassionate Healthcare, an internist at Mount Auburn Hospital in Cambridge, and Associate Professor of Medicine at Harvard Medical School.
Welcome to another podcast in the AHA's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance, and today I'm really pleased to be joined by Dr. Beth Lown, Chief Medical Officer of the Schwartz Center for Compassionate Healthcare in Boston. In addition to serving as the Schwartz Center's medical director, she's also an internist at Mount Auburn Hospital in Cambridge and Associate Professor of Medicine at Harvard Medical School, and an amazing human being. So today we're really talking about the importance of compassion in medicine. To get us started, Beth, tell us a little bit about yourself and your experience.
Sure. Thank you, Elisa, and thanks so much for inviting me to be here with you today. It's really a joy, and I'm looking forward to this conversation. It's hard to know where to start, I guess. When I started thinking about what I wanted to do when I grew up, I did not think about medicine. That was like the furthest thing from my mind. But when I was in college, this was quite a while now ago, but there were so many major social upheavals and social justice movements were so alive. The women's movement, the civil rights movement. There were massive protests against the war in Vietnam when I was in college. They've been giving away how old I am. And I felt that I needed to contribute in some way to serve others. And so I eventually found my way to primary care medicine, which seemed like a good fit for whole person care. And I can tell you a little bit more about that journey. It was not a straight line, but I can tell you a little bit more about that later if you wish.
Sure. Why don't you connect it to how you ended up working at the Schwartz Center and a little bit about that mission and where Genesis was and how it's moved forward in the last 25 years.
Yeah, so I think, I always felt a little bit like an outsider in medicine because I was really, really interested in things like compassion, relationships, empathy, communication, how we really meaningfully connect with people. And I certainly wasn't taught any of that as I was going through medical school or training. So I learned it on my own and practiced it and felt it in my primary care practice. In 1999, I was nominated for the first Schwartz Center Compassionate Caregiver of the Year Award by a couple that I took care of in my primary care practice. And I had come to really love both the husband and wife. They were both my patients. I loved them really dearly over time. And they were the ones who nominated me. He was dying of multiple complex conditions, and when he became too ill to come see me, I would just go see them at home. And in those days, that's what I did. If somebody became too ill, who was a patient of mine, I just transitioned into doing palliative or hospice care in their homes, which I found to be extremely meaningful. But it was challenging to work our way through all of these really tough decisions. And so since I was an intern, was writing poetry about my patients and their families to make sense out of my own experiences. And so during the course of my care for them, I wrote a series of poems. And when he died, I gave the wife the series of poems. She had her son read them at the funeral, and then she crafted them into this beautiful handmade book, which she gave back to me. When she died years later, her son invited me to read a poem from that collection at her funeral. And I've been involved with the Schwartz Center since those early days because of that patient and her husband. And she somehow saw that I lived the mission, really. I lived for the mission, and I lived the mission. That is how I got involved with the Schwartz Center. It's a long story.
That's just such a wonderful story that this patient who got so much compassion and recognized the compassion you had was able to bring you to your work, spreading that compassion across the country. Can you talk a little bit about your work at the Schwartz Center? What is compassionate care, and how do you talk about it with your membership and in spreading the word about the work that you do?
Yeah. Well, let me just back up a little bit, because I want to tell you Ken's story now. I know you're interested in storytelling. Is that okay, Lisa, if I go into Ken's story?
Absolutely.
And how the Schwartz Center got born? So the Schwartz Center really grew out of Ken's story and out of his vision. So you may know he was a healthcare attorney, and he became ill. He was 40 years old. He had persistent cough and fever and malaise, and he was given antibiotics, and he kept going back and forth to his primary care team. But he ultimately felt that people were not really caring about him. They weren't really listening to him. He switched practices, and 3 months after the onset of his symptoms, he was diagnosed with non-small cell lung cancer. And he described what he called his harrowing ordeal with surgery, radiotherapy, chemotherapy, in a beautiful, timely, still very relevant article that was published in Boston Globe magazine back in July of 1995. And in that article, he describes what he called exquisite moments of compassion, the simple human touch from his caregivers that, in his words, made the unbearable bearable. Before Ken died, in September 1995, he called his friends and his family to the bedside and asked them to start a center so that compassion would not be extinguished in healthcare, and he was really quite worried about that. He was a healthcare attorney. He was an astute observer of health policy, and he was worried that the drive to reduce costs might occur at the expense of compassion and caring relationships. So that was the vision and the charge that he left to his friends and family, who then puzzled out, well, how are we going to enact this vision? What might this look like? They went to his care team, his oncology team at Mass General Hospital, and said, what do you need to sustain the compassion that you showed to Ken that meant so much to him? And they all replied, really with very little hesitation, that they needed a regularly scheduled time to get together to talk about the social and emotional aspects of taking care of patients who often have serious life-limiting illness, and how that especially affects them as caregivers. Let me just clarify, because there's sometimes confusion about the word caregiver, but we call anyone who touches the care of a patient or a family member in a healthcare facility a caregiver. We are all caregivers regardless of role or responsibility. So the Schwartz rounds were initiated by Ken's care team at MGH in the Cancer Center, and they have spread organically since their inception. So the mission right now is to put compassion at the heart of healthcare through programs, education, advocacy, and our vision is a world where all who seek and provide healthcare experience compassion. So we work on both sides of the relationships that are formed in the process of the provision and the receipt of care. Our primary program is Schwartz Rounds, and the Schwartz Rounds are now an international program. And again, anyone who touches the care of patients and their families can get together, talk about the emotional, psychological aspects of being a caregiver and how that impacts us, how it lands on us, how we think about it, how we feel about it. The Schwartz Center onboards and trains a Schwartz Center or Schwartz Rounds leadership team at a healthcare organization if they've chosen to become a member of the Schwartz Center. And we train local teams how to implement and sustain the rounds, and we train their facilitators. And that's a very special kind of training because we want to help people create a sense of safety, to have open and honest and authentic and vulnerable conversations about how they're feeling and what their thoughts are when they are taking care of people who are suffering. So these are facilitated conversations. They're based on a topic or a case that just bubbles up to a planning team within the healthcare facility, whether that be a hospital or a system or a clinic or a hospice. And then the case or the topic is discussed and described from the perspectives of a panel of caregivers from their different roles and disciplines. And then the facilitator opens and guides the discussion that follows. Everything we do is across the board. It's for everybody. So it's not just for one discipline, one profession. It's for the entire community. And I think that's part of what makes Schwartz rounds successful and valuable to people. So the rounds have spread. They've spread organically. We've done little to try to spread them, but they have spread across the U.S., into Canada, Australia, New Zealand, and our partners in the United Kingdom coordinate the rounds in England and Ireland.
Wonderful.
It's been amazing. It's been an amazing journey, and it really emerged from a story.
To pick up on that point, how do you see clinicians really using both, it's an art and a science of the storytelling?
Mm-hmm.
Because every time I've heard about the Schwartz Center, it started with Ken's story.
Right.
And how do they use that to really support each other and reconnect to their purpose and connect better to their patients?
Storytelling is just an ancient way of making meaning out of the human saga, isn't it? It's really, I think it's just a way that we try to understand the ways of the world. It's stories that we tell about how we live, how we love, how we die, and they're just essential to human existence. So I think from the time we're born, we live for stories, and we tell stories, our stories, other people's stories, our heritage, our legacy stories, to try to understand who we are and what the community is that we are part of. So it's a very old way of meaning making. So the Schwartz rounds are built on stories. And, I think in addition to Schwartz rounds, there are other ways that people use storytelling. You've heard about narrative medicine. We know and have seen and have participated in groups that write. I still write poetry. I started it as an intern. I haven't given it up yet. And in fact, tomorrow I'm going to read some poems at our holiday celebration of life at our hospital, which we run as the last Schwartz rounds in the year, every year now for 25 years, 20 plus years. So we all use storytelling, and I think more and more people, we learned at our conference, we had a wonderful Compassion in Action Healthcare conference last year about people are using all kinds of arts, expressive arts, visual arts, storytelling, narrative arts, video to express themselves and to capture stories of others. Reflection rounds is another way of doing this. So there's lots of ways that you can use storytelling to not just make meaning for yourself, but really to build a sense of community. And I can't think of anything that's too much more important than that to sustain ourselves and each other.
I couldn't agree more. I think that sense of community is essential to really being able to deal with the everyday pressures of the work that you do.
Mm-hmm, absolutely.
So how are you seeing, and how have you seen physicians, and especially I know you teach as well, really start to embrace the principles of compassionate care as that connector to their patients and to be able to better support their patients?
Mm-hmm. It's a really interesting question. We've all seen these acts. I mean, Ken, talks about these stories in his article. And one piece in his article that always stays with me is the story about a nurse when he was first going in for his lung biopsies. He was sort of in the pre-op area being screened, and this nurse was going through a checklist. She wasn't really looking at him, paying much attention. He happened to mention that he had just learned he had advanced lung cancer. She must have heard something in his voice, because she put down her checklist, looked at his eyes, and just stopped and said, "How are you doing?" And they entered into this conversation, And then the next day, Ken was lying in a Johnny on this cold gurney outside of the OR, waiting to be rolled in. This nurse came down looking for him, sat next to him and held his hand until it was time to go into the operating room. And those are the kinds of small acts that were so important to him. And we've seen these. We see this all the time, and they're discussed all the time at rounds. We heard a wonderful story, a heartbreaking story, about a family whose baby died shortly after birth, and they were beside themselves when they realized that the baby's blanket that they had, brought with them to treasure had accidentally been discarded. And the environmental services person just scoured the hospital and ultimately found that blanket in a dumpster and brought it back to the family, who couldn't thank him enough. We had rounds at my hospital. I think it was one of my all-time favorite rounds when the transporters of the hospital told their stories. And there was one woman who talked about how the only time she felt comfortable and safe was when her transporter wrapped her up in a blanket, helped her into the wheelchair, and then he just rolled her all over the hospital, singing, talking, telling her jokes, just making her feel alive and calm. And most of the time she was going to radiotherapy. So these acts are happening every day. I think one of the special things about sharing them, speaking them, visualizing them is that not only do they come alive, but they get coded into our memory. And that's so important. We need that sense that there is this beautiful work that we are engaged in and that we can share and that we can be proud of. I think it happens all the time. What I worry about is that we have to create organizations and systems that doesn't squelch that. And that's really of concern. The pace is fast, the volume is high, the throughput is enormous, and there are all these other distractors that take our focus away from patients. If we don't create the environments and the context that can support our compassion, it will be at risk. And you see this in the burnout epidemic and the anxiety, depression, the suicide rates amongst physicians in particular. This is a serious public health and organizational crisis that we have to address. So it happens. We all have our innate compassion. I think it's why most of us go into healthcare. What we need to do is figure out how to sustain it and not put barriers in our way.
Absolutely. And I know that's a large part of the work that we hope to do at AHA and in partnership with the Schwartz Center, co-sponsoring the conference that you hold every year to really bring this information to light.
Mm-hmm.
So let's wrap up with what advice would you have for those who are listening to this and saying, okay, I might want to be more methodical and more conscious of incorporating compassion and empathy into my work, into my daily life. Where do I start?
Yeah, another really great question, Elisa. I think there are two ways to think about this. The one thing is, what can I do for myself? Actually, there's three ways. What can I do for myself to sustain myself? What can I do for my team? And then what do I need to do with others in the organization? Like I said, I think some of the dilemmas and the challenges that we are facing are organizational, systemic problems, and none of us can address these alone. So we really need to stand together and advocate for the kinds of organizations, systems, and policies that actually support our innate compassion, because it's there. We have to look for the solutions to all kinds of barriers that ultimately can lead to burnout, anxiety, depression. So I want to make that clear that is a top priority. We can take care of our own well-being and take care of our team's well-being this is essential. We need to maintain ourselves as well as our ability to care, not just for patients, our own families and our loved ones. So, how you go about this, I think it differs from person to person. But I was thinking about this recently, and I think if you start by asking yourself, when do I feel most able to give and to receive love, to experience a sense of peace, a sense of connection with my most deeply held values? When do I feel that? What is it that I'm doing when I feel this way? So if you're able to find this within yourself and what lights you up from the inside, and then figure out how to make it possible to do more of it, whether that means talking to leadership or managers to enable you to do more of what you do best and what sustains you, I think you'll be able to walk through the world with the compassion you have inside you.
I think that's some great advice. I really appreciate you joining me for this podcast.
Thank you for inviting me.
And for the great work that you and the Schwartz Center team do. I'm looking forward to the conference next June 2020.
That's fantastic. Thanks so much, Elisa. I hope people will visit our website and register up for that conference in June. It's going to be terrific.